Dr Michael Dixon has been at the helm of the NHS Alliance since its creation, and since then he's helped raise the profile of primary care and clinical leadership. Well, he's decided to step down as chair. Rick Stern has been with the NHS Alliance for 10 years and he's also leaving after 4 years as chief executive. But they're not leaving before a chat about the Alliance's achievements and its challenges in the future. Well, you've got quite some perspective on what's been achieved in the last 18 years and the last years specifically. But what would you say, I guess, are the main achievements?
Well, I suppose we've been a friendly critic, or some would say a thorn in the side, of government and Department of Health and those running the health service during those 18 years. And I think had quite a major impact on some of the policy and implementation. I suppose particular things I'm proud of are the fact that clinical commissioning is now happening after those 18 years, with clinical commissioning groups now taking up the reins of local planning and commissioning.
We've pushed and prompted with messages from the front line to try and ensure that the health service reflects what people really need. And I'd particularly pick up on that shift from commissioning, from ensuring that the clinical voice was at the forefront of the decisions about money in the NHS, to a whole new perspective on the way integrated provision can happen.
What do you feel the role of the community will have in the future?
Oh, I think it's absolutely essential. If we're going to have a sustainable health service, it can't be something that politicians and clinicians simply do to patients. We've got to totally turn things on their head and make individual patients and communities assets in their own care, and therefore part of making the health service sustainable. If we don't do that, we've not only not invested in what the health service is, which is an act of goodwill between fellow man, we've missed a trick in that respect, but also we're going to lose the immense amount that patients and communities can do in terms of not only advising how to run health services locally, but also being part of their production and implementation. That, for me, is the great trick that we now need to pull off in the NHS to show the rest of the world how a health service can run, not simply as a service for its patients and communities, but as if you like, a mutual production by both.
And in the end, it's all about how we do this together. So that's true both of the wider community and of the Alliance itself, that actually it's not just about working within general practice, within primary care, but it's about housing, it's about fire and rescue, it's about education, it's how everything comes together to provide those broader solutions, the social prescriptions that improve people's well-being, that stops them being lonely and isolated, rather than just prescribing medicines, which are just one part of it.
That's so true, and I think that, in a sense, that's what Alliance has been for me for the last 18 years. That's to say, we've all had day jobs, we've all done it in our free time. Most of the activity has been emails at weekends or telephone conversations after work at 9 o'clock at night. So I think, in a sense, we felt we wanted to put something back into the health service that wasn't part of our professional description. And we now need to move that feeling and ethos into communities, into practices, into patients' homes, and into around the health service, and create, if you like, that goodwill that I think will fire the health service into the future and make it sustainable.
Gentlemen, thank you both very much for your reflections today, and we wish you lots of luck in the new chapters in your lives. Thank you so much.
Thank you.